Hi, I'm Ian Early with Woodlands Psychotherapy and Brain Training. Welcome to part 2 of my OCD video series. Now, the topic of this video is how to identify an OCD thought, or how to determine whether a thought that you're having really is OCD or not. One of the most challenging aspects of OCD is recognizing whether a thought is part of your OCD cycle or is just a normal, typical concern or worry. So what I want to do in this video is explore how to differentiate between those two and build awareness of your mental processes. So first, let's talk about what makes an OCD thought OCD. OCD thoughts are intrusive, persistent, and often irrational. They create a sense of urgency, and the most important probably aspect of it, they compel you to perform a specific action to reduce the anxiety that it causes. Unlike regular thoughts, OCD thoughts often feel sticky. They're hard to dismiss and they keep coming back. How do OCD thoughts differ from normal worries? A typical worry might resolve once you've addressed whatever the concern is. An OCD thought, however, will linger and escalate even if you logically know that whatever the fear is unfounded. For example, a normal worry about locking the door fades after checking it one time. An OCD worry, however, would persist, making you feel the need or compelling you to check the lock multiple times, even though you know that you already have. Recognizing the what if pattern. OCD thoughts very typically start with what if and then spiral into catastrophic scenarios. Identifying this is an important step in labeling a thought as an OCD related thought. For example, what if I forgot to turn off the stove might escalate to what if the house burns down and it's all my fault. Now, in subsequent videos in this series, I'm going to talk about ways that we treat OCD and strategies that you can use to overcome OCD, specifically exposure and response prevention. But before you can implement any strategies, you have to be able to identify whether a thought is an OCD thought or not. So that's why I'm focusing on that in this video. Here's a simple 4-question test that you can use to try to identify whether a thought that you're having or a worry that you're having is one of these OCD thoughts or is just a normal worry or a normal thought. Question number 1, does this thought cause me anxiety? Question number 2, do I feel the need to do something about this thought? Is there some action that I feel compelled to take? Question number 3, is this thought repetitive or looping? Does it continue coming back and get stuck in my head? And question number 4, does it start with what if, like I talked about earlier? If the answer to those 4 questions is yes, then that thought most likely is an OCD thought. OCD can often get extremely convoluted and complex and difficult to differentiate between whether it's an OCD thought or a normal, typical concern that everybody has. At Woodlands Psychotherapy and Brain Training, we specialize in evidence-based treatments like exposure and response prevention for OCD. If you feel like you need professional help to manage your OCD, please reach out to us and we're here to help. Thank you very much for watching.